Welcome back to Clarkston Lighthouse Counseling. I'm Chandler, owner of Clarkston Lighthouse Counseling, and this is Clarkston Lighthouse Guidance.
Hi, I'm Victoria Fleming, and I am co-owner and therapist at Clarkston Lighthouse Counseling. Welcome to Clarkston Lighthouse Guidance today, when we are going to be talking about borderline personality disorder.
Yeah, it was really my idea to talk about this subject. It's something that's coming up more and more in my practice, where people are living with individuals who suffer from this disorder, and it's a challenging illness.
Right, and this time we're going to it's going to be more informative. It's going to be less about dealing with maybe someone in your life that is a borderline personality disordered individual, and really just looking at what is borderline personality disorder.
Right, and there's a lot of confusion about it. I mean, personality disorders in general, there's a lot of confusion about what it is and what the effects. In psychological diagnosis, there's like a primary diagnosis or an axis 1 diagnosis. And the personality disorders are considered developmental disorders. They tend to be more lifelong. So one of the definitions, just to kind of help us get started a little bit, is a pervasive pattern of maladaptive coping or functioning, where a person, I can't read my own slides. Well, it's more characterological, and it's a pattern that's lifelong. It begins in early adulthood or late teenage years, and it's more of the personality.
Right, and that's for personality disorders as a whole, not specific to. So it's an individual who, like you said, is maladaptive, is someone where it's not just quirks, it's not just certain personality qualities, but is this pervasive, as you said, pattern of behavior.
Sure.
Where you begin to think, gosh, something seems slightly off, something's amiss here.
And it's really kind of how that person is. Personality is a really key word, and I've thought for a long time, how do you define personality? And it's those characteristics. It's part of who we are. So when I say, he's got a really funny personality, I think everybody knows about it, or he's got a very analytical personality. So it's those kind of characteristics of a person, who they are, and sometimes those characteristics can be quite negative. I mean, can be pretty maladaptive, and it causes pain in their lives.
Absolutely. And I know in the beginning slide, it was talking about that it's a difficult and painful personality disorder, the borderline personality disorder. What is it about the borderline personality disorder specifically that causes it to be difficult and painful?
Well, I think one is some of those characteristics of the disorder is this intense anger or lack of anger, and then over-idealization and undervaluing. So we oftentimes talk about the good mom, bad mom sort of situation, where at some points those people really, love you and care about you and have a strong need, and at opposite times it's just the opposite. They feel abandoned and so forth.
And it's really one of those where it's love to the point that they're putting you on a pedestal.
Yes.
And then you fall off the pedestal, and you didn't ask to be put on the pedestal, and you didn't ask to fall off the pedestal. And so it's one of those love me this way, so they're pushing and pulling at the same time, and that's something you'll see very often in someone with a borderline personality disorder. And you'll feel very frustrated because it's like I said, they're pushing you away at the same time that there's this strong need to pull you closer, and it does cause conflict and challenge.
So there's a lot of, with all diagnosis, there's a lot of confusion about what it is. So let's just kind of look at what the DSM5 says. And the DSM5 is the Diagnostic and Statistical Manual for Mental Disorders. Oftentimes it's called the Bible of Psychological Diagnosis. And some of the criteria that it points out is that it's a pattern of instability in interpersonal relationships, self-image, and affects, in marked impulsivity. So let's take a look at it. Instability, we all know what instability is. It kind of goes back and forth. But also those part of that too is when we say affects, oftentimes that word is, in layman's terms, is more mood, expression, things along those lines. So again, the relationships tend to be pretty messed up.
Right. So for example, if a person was talking about a flat affect, that is someone who's very difficult to read, because literally their face just is kind of a mask of inexpression.
Yeah.
There's just a flat affect. So when they're talking about that personality disorder affecting the affect,
Sure.
then, like you said, there can be that lack of anger or the extreme anger.
Right. So let's look at what the DSM-4, what their criteria is. Anybody at home could probably just Google DSM-5 criteria for borderline personality disorder. It gives a little bit more detail to it, but this is kind of the quick overview. Frantic efforts to avoid real or imagined abandonment.
And I think that's super important, real or imagined
Sure.
abandonment. And because there are very often times where it's imagined.
Yes, for sure. And that fear of being left alone is pretty common. Unstable interpersonal relationships with alternating love-hate, or what we call that over-idealization, undervaluing. I love you one moment, hate you the next.
Right.
Identity disturbance in at least a couple different areas. So you see gender identity disorders, lots of people with gender identity disorder have lots of borderline personality features.
Okay.
So there's this high correlation between it, but also just not even just gender identity, but just who they are in general. What do they value? Who when you ask them to describe themselves, they're unable to do that. Impulsivity in at least two potentially dangerous situations. So a lot of times you see sex or spending or drugs, dangerous hobbies, things like that, where there's risk. Lots of impulsivity in those two areas. And then some other of the DSM-4 criteria for personality disorders. In the next slide talks a little bit about the reoccurring suicidal behavior. So that could be just thoughts. It could also be acting out behaviors. A long time ago, before self-injury became so common, you would see a lot of self-injurious behavior. It was kind of hard to know if that falls into that category of suicidal behavior or just self-injury.
Right.
Affective instability due to unstable relationships and the reactivity of the mood.
Right.
So a lot of times people would get confused, like borderline personality disorder. So somebody would say things like, I think this person's borderline, and there is a strong correlation between the two.
Right.
So
and then we're also looking at that inappropriate anger, the lack of anger, as well as that transient stress related paranoid ideation that goes on.
Right.
Describe that a little more.
Well, obviously transient, it comes and goes, but they really believe beyond reality and beyond what was culturally held that people are out to get them, that it could be as extreme like, that there's a conspiracy out to get them. And over a period of a day, they may not feel that way, but for some intense 20, 30, 40 minutes, they're maybe checking outside to see if people are coming to take them away.
Now, it's very interesting. So some people would, I think of that as paranoid schizophrenia,
right,
or something. So how does a person start differentiating between borderline personality disorder versus another diagnosis?
Well, it's difficult, and that's one of the problems with all personality disorders in general, is trying to differentiate it. With personality disorders, you look for that lifelong pattern, and then you look for, a lot of times, the more severe symptoms come and go. So with schizophrenia, there's a pattern lifelong, yes, but it doesn't come and go usually. It's present at all times. With a lot of the symptoms of inappropriate anger, it doesn't last all day usually. It's usually several hours. That paranoia is just for a couple hours, or really usually only 20, 30 minutes.
For the borderline personality disorder individual. So as we are looking at that criteria, how many of those criteria would a person have to meet in order to meet the borderline diagnosis?
Probably five out of the 9 that are listed there. So 5 out of 9. And again, I would recommend to people that they hold off diagnosis and let a professional do that. It's a difficult and tricky diagnosis, so leave that to the professionals. But if you have questions and you wonder, hey, I wonder if my partner, wonder if my boss, I wonder if this guy that I met who was great and now is just like calling me all the time and wanting to know why I hate him, what's going on? You might want to look at the criteria and see, and kind of take it from there. It's a good starting point.
And why save it for the professional?
Well, a couple of things. One is that it's just tricky. It's difficult, and I know I've worked with a lot of professionals, and especially a lot of newer professionals I worked with. You really have to slow them down and get them to take a look at it. Because borderline personality disorder has a long history. It used to be not a personality disorder, but also it was considered a dissociative disorder, where people kind of tune out, get kind of like in a sleep state sort of thing, and kind of lose track with reality that way. And then again, as I said before, self-injury used to be a pretty big part of it.
So let's take a look at, so we've looked at the diagnostic criteria. What does it look like in a person's actual life? If you are interacting with a borderline personality disordered individual, what are some things this person's going to encounter in the day-to-day?
Sure. So in the day-to-day, it's a roller coaster. And it kind of depends on what part of the day you run into them. It's frequently said by laymen, oh, this person's quite bipolar, because yesterday they thought I was the greatest person and the best friend in the whole world, and they loved me and cared for me. And then something switched, and they are asking me, why are you hating me? Or, just leave. I know you're going to leave me, so just leave.
So you're saying that a borderline personality disordered individual could be, in layman's terms, called bipolar because of that swinging within the day-to-day relationship, where I love you, hate you, love you, hate you, I'm angry, not angry. What else? Let's say that you're a boss of a large staff and there is an individual who is borderline personality disorder. What is that boss going to encounter from that employee?
Well, they encounter a lot of different things, but one of the things to look for is really their history. Most people with moderate to more severe borderline personality disorder don't keep a job more than 6 or 8 months. They tend to again start off sometimes to get the job being very likable and friendly and agreeable, and then really confront you on, why do you hate them? Why is it that you're doing that you're ready to fire them? And then that impulsivity. They might do a lot of just, great person, and then one day they come in high. Could definitely be a sign. Or they'll steal from you because their personality says, that instant gratification, that instant fulfillment.
And it's actually that impulsivity that would be a likely cause for losing the job, because that impulsivity could cause them not to show up for several days in a row, or to do something inappropriate at work, to act out in that angry manner. And,
very early in my career, I had a lady who suffered from borderline personality disorder, and it was really, really new. I hadn't even gotten my master's at the time, and I saw some severe cases in the hospital where I had worked. Went to an outpatient clinic, and we were talking about the concept of boundaries. What's private, what's not private. And I brought up an example of this lady played tennis a lot. I said, if you were playing tennis and one of your guy friends were there, and you had to really hurry, would you get naked and take a shower in front of them? Oh, sure, why not? And this was probably like early 90s, so that was even more remarkable back then. I think of a lot of people today, the boundaries have disintegrated. But it was definitely, they really did not recognize just the difficulty in going about and having good boundaries, where they began and where they ended.
I think the boundaries thing is a very excellent example of how that impulsivity and how that their very core of who they are is impacted by it.
Sure.
So is there help?
There definitely is help available. It is a difficult disorder to treat. There's a lady named Marcia Linehan who's out at the University of Washington, and I've heard things that she has a lot of signs of self-injury. So she probably at some point of her life struggled with borderline personality herself. But she really helped engineer with some other people dialectical behavioral therapy. And dialectical behavioral therapy, or DBT, really helps people with borderline personality disorder deal with those strong emotions. And it's one of the things that she thought was key is really 2 things. One is skill giving. to give them the skills to try to function, and two, giving them adequate time to deal with their pain.
And I appreciate you said strong emotion, because for that individual who is borderline, the emotions are very intense. They are in pain. It is challenging for them. So that would be a goal of therapy, is, as you said, to give them a skill set in order to be able to deal with that strong, if it can feel overwhelming,
right,
emotion.
And it's interesting because, you know, oftentimes people with borderline personality disorder get accused of being manipulative. And some of that skill set is getting them to learn how to manipulate.
Right, because they're actually not good manipulators.
Right.
It just seems like they're. So what would it be about their personality or about this disorder that would cause people to accuse them of being manipulative?
Because they're so bad at it, because it's very, very obvious. You know, somebody with borderline personality disorder says, if you don't date me again, I'm going to kill myself. Well, that doesn't usually help the person want to date them anymore.
Mm-hmm.
So they lose those skills of how to get what they want in a way that's much, much more socially acceptable. So they're just really, really bad manipulators. That's kind of an extreme example, but sometimes they are extreme. You know, a person with borderline personality disorder may want to go to the store, but instead of coming right out and being able to say, hey, wouldn't it be cool to go to the store? They would, you know, come up with something that's pretty maladaptive. And so they don't know how to get their needs met. And that's really a big part of the skill building, is being able to get them to self-soothe, but also to get them to recognize that there are more indirect ways of getting what they want.
Okay, so when we do move into another show where we're going to be dealing with it, that's when you're going to break it down to, so you know someone who, you've watched this, you've read up on it, their borderline personality disorder diagnosis, and we'll be able to help them kind of look at, what do I do now?
Yeah, I definitely want to take a look at that in another show. And to repeat myself, I would encourage anybody who sees the show and thinks, hey, maybe I have borderline personality disorder, or maybe I'm living with somebody who has this, is to really take a serious look at what some of those symptoms are. Help is available, but because of that over-idealization where the therapist can be great one day and then horrible the next day, it's important for them to dive into therapy and to really look at what is it they want, and really to commit a time frame. Very early on with somebody that I suspect, based on their history, has borderline personality disorder, and you know, you're kind of seeing them on the first couple sessions on the good side, is really getting them to commit to be involved in therapy for a prolonged period of time. One lady in particular I think of who you know, took negatively to therapy. I really asked her, you know, how many different therapists have you had? And I think I was therapist number 8, and pointed that out to her, that I could help, but that they really needed to commit to that.
Right, and recognize their pattern of behavior because of the diagnosis. And again, we want to emphasize diagnosis is information, is just an opportunity for for the professional to know this is what we're dealing with, and now this is what we need to do.
Right.
It doesn't have to be, you know, we talked about diagnosis and how it can have its pros and cons.
Yeah. And the very last thing, kind of in closing, I wanted to include is the amount of pain that people are experiencing. That people with borderline personality disorder experience a great deal of emotional pain, and it's very important to remember that they're not enjoying it. And I hear that a lot from family members with somebody who's suffering from borderline personality disorder. They just want to get even. They just want this. They just want that. And that's rarely the case. They really don't know how to get what they want in a socially acceptable way, and they do experience a great deal of emotional pain. So if you suspect somebody in your life and need more information, please give us a call at Clarkston Lighthouse Counseling, and we'd be glad to answer those calls. We are accepting new clients, and I do work with clients with borderline personality disorder.
And that phone number is 248-245-1809. Thank you so much for joining us today.
Thank you so much for watching.
The views expressed in this show are for general educational purposes only and do not constitute professional advice on any subject matter, nor do they necessarily reflect the views or opinions of its guests or of Independence Television. If mental health assistance is needed, please seek professional licensed treatment.